I came to Qatar in 1994 on the instant of my brother who was working as a pharmacist in Qatar. And he initiated me to write the exam, and we wrote the exam and we passed the test, and then we found out a sponsor, a very good sponsor. And then we started the business of in that road, to Dukan Road. There was an old souk, Alatia souk. Near there was a clinic actually before that. I started off, and then we took over that clinic, and then we remodified, and then we started off the clinic. See, I was working as a tutor in the medical college in India. When this call came to me in Qatar, so I took leave from there and then came here and started off the work. Before it was a small clinic, and then we picked up patients, like that. Little by little we stepped up our work. But I should say one thing. The patients in Qatar were very cooperative and friendly. These two things were very imminent from that time onwards. It was like that, So that was the reason I continued, And in between, I had to bring my family visa was given to me. So for the first vacation I went to India. I came back with my family. My children grew in MES, studied in MES school. I have only 2 kids, both are boys. So like that we started off, and we are a happy family, and we started off with the people in Qatar as it now.
Sure.
When I was working there, His Excellency Tamim's father was the monarch here in Qatar. We started off as a solo clinic, and recently there was a checkup from the Ministry of Health. They told everything was good, and I am working as a general practitioner, so that I can cater to almost all the cases except dental. We treat all the patients that comes here except dental patients. Otherwise, for low backache, for lower tract infection, for UTI infection, for sinusitis infection, for all infections people come to me. I have a wide diversity of patients of Qataris, Sudanese, Bangladeshis, Pakistanis, Indians, everybody. All categories of patients come to me. The one thing that I want to tell you about our specialty is we don't unnecessarily check our patients unnecessarily. Blood work and other things, we don't do that. If it is necessary, if I feel that this patient needs a blood checkup, I send it outside and check it out. See, here if they come, they can finish the job in 30 minutes and go back. So that is one thing. The easy of things at Ramesh Babu's clinic. That is what Qataris also need. That is one thing. Then we give medicines of prior quality. We don't write any generic medicine. We give medicines of the highest quality. So we give them high profile medicines that cures them. That's all. That is the second thing. The third thing is our environment in this clinic is very, very friendly and lovingly. We cater to the patients in the most generous way. If somebody says, I don't have money, we just leave them. We ask them to pay what is with them and then leave. We don't argue with them, especially with the women. We don't argue at all. We don't argue at all. And that is the third thing. And the fourth thing is we give something that the patient needs, some advice as to how to change their lifestyle, to make a healthy living and holistic living. That is something from my side only I am giving them. because that is what I have studied all these years from experience. I get that and I tell them. For example, if somebody has, don't sleep, they don't sleep properly, some patients tells me, then I tell, you do exercise, you do 45 minutes walking, you change your lifestyle, you take the food, that is something that is good for you. So from the exercise, from the food, from the daily habits, to stop smoking. So like that we tell them and advise them. Other than the medicines that we give them, we tell all these things. So that is how we cater to the patients. See, I want to tell something also. This is the Ministry of Health in the last 10 years. In the last 10 years, from I think from 2015 onwards, they started this, CME points for the doctors. I have to take about 80 points of CME points from category 1 and category 2 to enable me to renew my license. So that is how they are doing it. So they are making the doctors study again all the things that they have gone through to make them more capable of dealing with the patients.
Yeah.
And there are a number of seminars and other things, meetings going on in the Ahmed Hospital and Weill Cornell Medical College, where we can go and attend that and get the points also.
Yeah.
Also,
like we can say like updates.
Updates,
Like
updates.
for the education of doctors,
yeah.
like to keep them always like have if there is anything new or any disease
Yes.
new or something, like
Yeah.
they can know the cure for those diseases. And
Yes.
always, like,
So there is a tremendous updates coming in the medical science in all diseases, in all categories. There are updates. For example, if you ask me one example, that is with the stroke patients. Stroke patients, if you have one, you should inform the the emergency in the first 4 hours. You should inform them. In the first 4 hours, there is a special treatment for them. After 4 hours, there is another treatment for them. So that is the protocol they are following. See, so everywhere, and also that we do this, this first aid things, that's with the Ahmed Hospital, and also pediatric first aid also we do with the Ahmed Hospital. That is every 2 years we have to do that again and get the CME points also, and then do that. In the future, we are trying to enable this go on, and then if there is anything that can be inculcated into this clinic, we are thinking of some dental patients coming in, some general medicine people coming in. So we are thinking of that. So, but we have to assume that the rules and regulations have to be followed in the proper way. I take this opportunity to express my gratitude and thanks to Sheikh Hamad bin Al Thani and Sheikh Tamim bin Al Thani for their cooperation and allowing us to work freely in this country. Also, I want to thank my sponsor, Mr. Khalid bin Abdullah Al Latia, the Defense Minister of this country, for giving me a free hand to work in this country as an entrepreneur and a doctor. I wish to thank, first of all, my sponsor, then my friends like Koshi, my brother Suresh Babu, my family, and all my close friends. I am not telling them the name, but I am making a big thank you to them for allowing me to work freely in this country.